Well, it's spring break season, or maybe it's just ending for you, or you might be excited to plan another trip. First, though, you'll want to keep family health in mind, and you may have heard of measles cases popping up around the country. According to the CDC, 113 cases have been reported in 19 states. That includes Indiana and places like Florida, where you might be going or coming back from. Dr. Shannon Dillon with Riley Children's Health joins me this morning to talk about what doctors are seeing. Dr. Dillon, did I get your first name right, or is it Shanna?
It's Shannon. Thank you.
Shannon. Okay, I've got an H in here, so okay, good. Glad we cleared that up. Let's start with this. First of all, what is measles?
So measles is a virus, and it can start off with very similar symptoms to other colds. The common thing that we always think of is a cough, conjunctivitis or pink eye, and then a really runny nose, and usually you get a really high fever. And then classically what tells us that it's measles is that you get this really bright red rash that starts at the head and it works its way downward, almost like a bucket of rash has been poured over you.
Oh gosh. How concerned should parents be about their kids, and then also what about themselves?
Well, if parents and children have been vaccinated, they actually don't need to be too concerned because measles is a very effective vaccine. It's been available since the 1960s, and one dose confers approximately 93% immunity to the population. We usually give people 2 doses over the course of their life in most cases, and that gives about 97% of people immunity. So if you've been vaccinated or if your kids have been vaccinated, you generally really don't need to worry at all. But because there are some people who are too young to be vaccinated or who for medical reasons can't be, those people are extremely susceptible to measles because it's one of the most contagious diseases that we know of. So for example, one person with COVID might infect 1 to 3 people who they're around. Measles lingers a long time in the air, and on average infects 15 to 18 people. So if you're not vaccinated and you're exposed, it's quite likely that you're going to become sick.
Some people might be going, wait a minute, measles was declared eliminated in the U.S. in 2000. Are there reasons we are seeing these outbreaks now?
There are. For a variety of reasons, we're seeing fewer people being vaccinated against measles. The pandemic didn't help because there was quite a while where people weren't able to get, especially their children, in to see the doctor to be immunized on the normal schedule, which is usually 1 dose around the time that you turn 1 and then 1 dose again after you turn 4. So we're still working on catching people up. After the pandemic and the COVID vaccine, there have been a lot more people questioning vaccines for a variety of reasons. And I think with things on social media, there's been some more misinformation spread. So that's led a lot more people to be hesitant about things like the measles vaccine as well, even though, as I said before, we've had it around for 50 years now, and we know it to be quite safe.
And before we let you go, what should parents do if they think their children have been exposed?
So if you've been exposed, you should definitely reach out to your doctor. It's best to call rather than showing up because, as I said, patients would be quite contagious. And so we do want to limit exposures to other people who are in the doctor's office. There is some benefit to being vaccinated right after you've been exposed, if it can be within the first 48 to 72 hours or so. So if your child hasn't been vaccinated, but they're old enough to, getting the vaccine right away can help. Otherwise, unfortunately, there really is no treatment. It's just symptomatic. And 1 in 5 people who get infected with measles will be hospitalized. So it's much better treatment to have prevention as opposed to working on taking care of people who've already gotten sick.
Dr. Shannon Dillon, it was great to have you this morning. Thanks so much.
You're welcome. You guys have a great day.
You too. And we've made it easy for you to access this information at home to keep you and your family up to date. Just go to fox59.com/links.